Good afternoon to the Twin Saults, Algoma and Chippewa. Thank you very much for joining us for a special report this afternoon on Wednesday, September the 30th, last day of the month, and before we turn the calendar over to October tomorrow. Thank you very much to KC Securities for sponsoring Special Report. We greatly appreciate that. Before we go over to Weather Daniel, we are waiting for Doug Ford's press conference. He's going to be joined today by Christine Elliott, the Deputy Premier and Minister of Health, as well as Dr. David Williams, who's the Chief Medical Officer of Health for the province of Ontario. And also a reminder, just after 2 o'clock today, we'll also be carrying question period, and Justin Trudeau will be in question period today, coming to you from the House of Commons in Ottawa. And now we're going to go over to Weather Daniel. What's up, buddy?
Hi, Weather Daniel here with your On TV Weather Minute. We're going to take a look at our camera now, which is sponsored by wirelesscom.ca. Check their website out. It's a bit of a mixed bag today. We're going to see a little bit of everything, and those winds will pick up today as we get into the evening, gusting up to 60 kilometers an hour. You'll see a low of 8 overnight. Thursday, those showers will continue, only a high of 9. Friday, though, you're looking at a low of 0 overnight. Freezing mark, mix of sun and cloud during the day, and overcast on Saturday. Sunday, Monday, Tuesday, you're looking at mix of sun and cloud, up to 14 by Tuesday, and our overnight lows are 3 degrees, down to 0 Friday, up to 11 on Tuesday. So we're a little bit back and forth. Thank you to Northern Lights Detailing for sponsoring our weather. This has been your On TV Weather Minute. Have a great day.
Thank you very much, Weather Daniel, for that, giving us a little update on what the weather's going to be like over the next 7 days. Just let you know, last night, some of you will already have known this, but there was a power outage in the West End. Started basically at Great Northern Road and went all the way out to Gross Cap. Power's been restored in the entire area as of later last night. There was a fatal motor collision out in just north of here, which was on Highway 17 North. Sorry about that. Donald Carroll Burns, a 31-year-old from Wawa, was driving by himself. His car flipped and he was pronounced deceased at the scene. The police are also looking for your help as well. Earlier today on Carmen's Way, a pickup truck which was traveling southbound on Carmen's Way struck an adult female pedestrian right around Albert Street West. She is in hospital with life-threatening injuries. If you saw this pickup truck, they don't have any specifics on the pickup truck, color, or anything like that. It was just a pickup truck. If you saw this, if you could please call the police at 705-949-6300, extension 348, and that is the traffic services with Sault Ste. Marie Police. And Doug Ford is there. Over we go.
Today, we're putting all the cards on the table. You'll always know what I know. You see the same information I see. On my direction this morning, the Chief Medical Officer of Health and the health experts released their latest COVID-19 modeling. The trends are deeply concerning. Cases are doubling every 10 to 12 days now. By mid-October, Ontario could see 1,000 new cases a day. We're starting to see a rise in case numbers across all age groups, not just among young people. And if these numbers keep rising, we'll see 200 to 300 patients in ICU beds per day. Folks, we have to work together to turn the tide in this fight. Our government has been working through the summer to develop a plan for this exact moment. We've been up here all week rolling out the details of our second wave preparedness plans. It's the most robust and extensive plan anywhere in the entire country. This is a plan informed by the best medical advice and science, informed by the Chief Medical Officer of Health. And I encourage every person in this province to read it, because I want everyone to know we have every single measure in place. We're taking every step. We're sparing no expense to protect the health and safety of everyone. We're investing over $2.8 billion in our COVID-19 fall preparedness plan. We put $1 billion on the table to expand testing and contact tracing. No other province has done this. 1,700 more contact tracers, adding saliva tests, expanding testing in up to 80 pharmacies now, with new locations being added every week. Yesterday, I announced another $500 million to support our long-term care sector and protect our most vulnerable seniors. On Monday, I announced that we're hiring over 3,700 more healthcare workers. We're recruiting 2,000 more personal support workers and 800 more nurses. And last Friday, I announced another $284 million to clear the backlog of surgeries, get people the treatment they need, and free up hospital beds. We're launching the largest flu shot campaign in the entire country. 5.1 million doses ordered this year, 1.3 million high-dose vaccines for seniors. My friends, we have the best plan in the country, and we are ready to respond as the situation on the ground changes. We have the best and the brightest minds working together on this. We have an army of frontline heroes helping to deliver this plan, but we'll need everyone pulling in the same direction. As the doctor said this morning, how bad the second wave is, how far it spreads, is up to us. And the actions are simple. Practice physical distancing, wear a mask, stay home if you're sick, get a flu shot, look after our elderly and vulnerable. The future is in our hands. When we look back on this time, let's be able to say, proudly as Canadians, as people of this great province, we did everything we could to protect those we care about most. Thank you, and God bless the people of Ontario. Now I'll pass it over to Minister Elliott.
Thank you, Premier, and good afternoon. Throughout the summer, we've been working in consultation with our partners in the healthcare system to develop a plan to ensure our province is prepared for a second wave of COVID-19 and the upcoming flu season, and to ensure patients will continue to have access to the care they need when and where they need it. Protecting the health and well-being of all Ontarians is and always will be our top priority. Over the last few days, we've been releasing the details of our fall preparedness plan entitled Keeping Ontarians Safe, and the key actions we have taken and will be taking to ensure our province is ready to navigate through the evolving COVID-19 situation. Our plan includes investing $2.8 billion to support our frontline healthcare workers, whose efforts we so deeply appreciate, and to protect each other and our most vulnerable. It's a plan that calls for strong public health measures, more testing, more case and contact management, and the largest flu immunization campaign in our province's history. Our plan is going to help us identify and manage outbreaks, help to reduce backlogs for healthcare services, and prepare for surges in COVID-19 cases. It's a plan that's going to help us recruit, retain, train, and support healthcare workers, and continuing to engage families and caregivers as we work together to get through these truly unprecedented times. In addition to all of our efforts, it remains critically important for everyone to continue following public health measures as we implement this plan. That means staying at home when you're not feeling well, and continuing to practice physical distancing with those outside your household or social circle or at gatherings. Protect your social circle. It's a safe place where we can hug our loved ones. And wear a face covering when physical distancing is a challenge or where it is mandatory to do so. Remember to adhere to gathering limits and wash your hands frequently and thoroughly. Only by working together can we protect one another and bring an end to the COVID-19 outbreak in our province. Thank you.
We'll go to the phone line.
Well, actually, I'm just gonna, you know, what I do sometimes in our press conference is really promote people showing the Ontario spirit. And there's two groups I want to give a shout out to. Had an opportunity to meet a young gal, medical student from McMaster, Nicole Creamy, and what a champion she is. She has put together a book called Patty in the Pandemic for the young kids reading out there. She did it all herself, and she just put it out today, and I ran through it. I introduced her to Minister Lecce, Minister of Education, and this is what I call the true Ontario spirit. Nicole, you're an absolute champion. And along with being a medical student at McMaster, and we all know how hard they work, she's found time to put this together. But do you know what I love? Everything she makes off this is going to charity, 100% charity. And the way you can order this is go to pattyandthepandemic.org. That's pattyandthepandemic.org. And again, keep up the great work. Here's an example of a young medical student giving back, showing the true Ontario spirit. I've heard a lot about the supplies, PPE, and I wanted to go firsthand to DVS and talk about a great team at DVS. I went out to Milton. It's a 1.1 million square foot facility. And these people out there are working their back off. I talked to the manager, said he worked 98 hours last week. They're going 24/7. One of their employees it worked 92 hours last week alone. Talk about dedication. Talk about pulling together. Folks, I'm so grateful. Everyone in this province is pulling together, pulling in the same direction. And again, to the folks out at the warehouse, thank you. Had an opportunity to meet so many of them, but most importantly, I saw firsthand millions and millions of N95 masks, surgical masks, gloves. This is just the warehouse for the 72 school boards. There was 39 million pieces of PPE. So we have plenty of PPE, not only for the schools, but for long-term care, for the hospitals, for the healthcare sector. And again, if you remember back in this pandemic when I called out for help and we had 26,000 companies go on the portal to switch over, talk about a team coming together, showing the Ontario spirit, pulling in the same direction. We're just an incredible province. I'm getting chills talking to you guys right now, because it's absolutely incredible, and I'm so grateful. You have no idea. I couldn't do this myself, so way to go, guys. Just keep going. We're going to get through it, and I always say, favorite saying is, tough times don't last, tough people do. We have the toughest people in the entire world right here in Ontario, the brightest people as well. So thank you, everyone. We're ready for the questions.
Okay, we'll go to the first question, please.
Your first question comes from Grant Lafleche with St. Catharines Standard. Please go ahead.
Hi, Grant.
Hi, Premier. Thank you for taking the call.
Thank you.
You're probably aware, sir, that there are, it sort of relates to the overall attempt to kind of bring the numbers down in this province. There are groups that are actively attempting to get people to avoid public health measures. The most popular group known as Hugs Over Masks. Here in the Niagara region, at least, they're encouraging people to try to spoof contact tracing by providing false names and phone numbers when they go to restaurants and other businesses that record that information for the public health unit should it be necessary. And one of the names and numbers that they're encouraging people to use, sir, is yours. So we just wanted to know if you, A, have a reaction generally to what these groups have been doing recently and the fact that they want folks to use your name and number to spoof public health contact tracing efforts.
It's so disappointing. Half the world has my cell number anyways. I'm in the office till midnight returning calls. It's nonstop. Folks, when I say nonstop, my first call came in at 6:30, but it's not about me. They can give out my cell number. I always say I play the smallest part. What they're doing, they're hurting their family members. They're hurting all the great people, the 14.5 million people pulling in the same direction. They're like rebels. Like, really? You really want to do this while everyone's working their back off? Have you ever walked through an ICU unit, seeing someone struggling for their life on a ventilator and having their loved ones outside in the hospital that they can't even see their loved ones? Have you ever been to a long-term care facility when people are struggling and the PSWs are out there working their backs off, putting their lives ahead of their own family and putting their community first? And you guys want to go out there and act like a bunch of yahoos? Like, that's being polite. I'm being polite with yahoos. Guys, give your head a shake. We're all in this together. You know, we've been on the phone with the feds, we've been on the phone with the mayors this morning. Everyone's pulling in the same direction. I'm so proud of how we're moving as a unit. It's incredible. It's absolutely incredible. We're putting $1 billion in contact tracing and testing. We're pouring money, $500 million into long-term care, $243.7 million into surgeries. And you want to pull these stunts? You know, good luck, because I'll tell you one thing, 99% of the population doesn't believe in what you're doing. You know, I'm here to protect every single person in this province, and I will do whatever it takes to protect them. And maybe I'll pass the question over to Dr. Williams about the contact tracing and that and what they're doing.
Yes, I would agree with the Premier. It's more than disappointing when that kind of behavior goes on. There may be some individuals who, for some reason, feel they can't cope and deal with the issue. It's not that complex. You just have to do what you're supposed to do and do it well. If we do it well, if we do our contact tracing properly, if we push the curve down, bring in the vaccine, we're looking for that day when you can go around and give hugs and you won't have to wear masks. But the longer we prolong this, the more we have to do it. So it's more to get along with the rest and do what you need to do in that regard and honor the responsibility and especially protect the vulnerable ones all around you, especially those of your relatives. You may have even younger people who have immune compromised situations. They just need to get contact with that virus, and you may do it by being careless and reckless. And you'd have a lot to work through if that person ended up in the ICU and passed away. So we really need you to be serious about this and stick to the task at hand. The contact tracing is very vital and critical, and we continue to drive that forward to ensure we contain it wherever we find it, because it's not spread as wide as we were the first way throughout the province, but in some areas it's quite intense, and we're continuing to really ramp that up in those local areas. So again, thank you for the question, and everyone needs to stay focused on the task at hand.
Follow-up?
Yes, thank you. Premier, and I guess to Dr. Williams as well, many people are a little confused or at least unclear of some of the rationale when you have to make some of the decisions you make regarding imposing new restrictions. You talked yesterday and today about what's going to happen with long-term care homes. In your Stage 2 and Stage 3 documents, in terms of the reopening of the province, there are 4 key public health indicators that are indicated in those documents, but there's no data attached to them, and there's no explanation as to how that data is used in your decision making. So I'm wondering if it's possible for Ontarians to begin to see the key public health indicators that are listed in your documents, see the data attached to them, and an explanation as to how you're using that data to make some of these decisions as the pandemic rolls forward.
Before I pass it to Dr. Williams, I got to tell you, and the doc's not going to say this guy's a champion. I'm telling you, I'd go to war with him any day on a pandemic, along with my incredible Deputy Premier, Minister of Health, but they're very pragmatic. When I say pragmatic, Dr. Williams understands health is a priority and the economy is right there. Health is number one, the economy beside it, about mental health. When people are holding on by their fingernails, a lot of these restaurant owners that are struggling, and be it bar owners or small business hair salons and nail salons, and he understands it. Believe me, he gets it. And he's doing everything he can, and he has throughout this whole pandemic, to have a happy balance. Make sure we take care of people's health, but we need to keep the economy moving as well. And there's no better person than Dr. Williams, and I'll pass it over to him.
Well, thank you, Premier, for those words, and more represent a large team of, I would use the same words, champions. We have a great collection of different specialists and experts who continually review the data, look at the information, speak with the local health units in their areas that have the data broken down to the granularity in different areas and neighborhoods. And I think when you're trying to compare what we did during the first wave, knowing it came on very suddenly, a lot was travel related, and we didn't have all the data and information we have now. We didn't have the testing capacity then. And so to compare the two, you have to understand the differences between then and now. Now we've learned a lot more. Now we know some of the things that affected our long-term care homes. We're ramping those up even now as we hear what's happening in ways and specific, targeted certain ones in certain areas. So that when we look at the data points, we were looking at broad-based ones such as number of cases in an area, number of cases per 100,000. We looked at positivity rates. We can break that down by areas. But some regions, some health units have one part of the area that's very high and somewhere where it's not that high. but nevertheless, they would prefer to take a region-wide approach to the matter. So if there was an easy formula and cookie cutter, we would do that. But because, as the Premier says, we're very understanding of what the different issues are. And if we can go after the target risk areas now rather than broad strokes, some have to be province-wide broad strokes. We have to remind again, as we did with the public health measures, with the distancing and with the social gathering in groups, those were provincial ones. But there's other ones we're going to look at a target level. So while there are those main numbers we're looking at, we're trying to assess those in regard to the local jurisdictions, what's in their areas, how do we keep the things open we need to keep open. We need to keep the schools open. We didn't have those open in stage 1, 2, and 3. And so we have to house them. Why? The evidence from the medical specialists, the pediatricians, as well as the child psychologists, says you need to do this. This is critically important for their health. So doing that in a safe way is what we need to do. That's different than we did with stage 1, 2, and 3. And there's other areas that the Premier's alluded to. If we don't do it carefully, we compromise people and put them in even a hazardous position, perhaps with mental health issues, perhaps with financial and fiscal issues. These are all huge impactors on people, and we have to be cognizant of that. So we have to be careful. First, do no harm. But when you need to act in a way that's timely, efficient, and effective, and carry out, as we do in medicine, the right procedure, the right medicine, the right prescription at the right time in the right way with the right dose. That's all important. That means you have to take everything into consideration.
Next question.
Your next question comes from Randy Rath with CHCH-TV. Please go ahead.
How you doing, Randy?
Yes. I'm wondering about your messaging to young people about COVID. It doesn't seem to be getting through to them. And we're talking today to a doctor named Naheed Dasani, who's a Peel physician, and he's used TikTok and Instagram to send out COVID messaging. And he's had tens of thousands of hits, a couple of 100,000 hits actually, or views on his messages. Why is it the province using platforms that young people actually use to get messaging out to them?
So a good question, Randy. I mentioned that the other day. I believe we're doing that. We're going to be getting messaging out on TikTok and other social media areas that the young people. But let's be honest with each other here, and you're always honest. I love Randy, by the way, guys. But let's be honest with the people. The young people know. Their parents tell them, their grandparents tell them, their family tells them, their friends tell them. Kids can't go to school without talking to their friends about it. They can't go anywhere without talking about it. So it's not all of them. There's a lot of great young people. Here's a young person right here, Nicole. That's just incredible. And I believe the vast majority of the kids get it. And there's the odd groups that go out there, and I heard they broke up a big party over at Western. Guys, I'm out there bragging to the world. We got the smartest young people, and I believe it. The smartest young people in the world, bar none. I've visited these colleges and universities. It's incredible what they do, and how they learn, and the expertise after they finish their college and university degrees. They're our future. So guys, just you got to follow the protocol. As I always say, you may get through it, but like old guys like myself or your grandparents or whoever, they may not get through it. That's the thing. So just think of your loved ones. Think of your grandparents. And I know you all love your parents and you all love your grandparents. So just please think of them. That's most critical.
Follow up.
Yeah, I've got another question entirely about migrant workers. There's 40,000 migrant workers in the province, and they're nearing the end of employment here, and they're going back to their home countries. And some of these countries will require them to have a negative COVID test before they're allowed to re-enter their countries. These workers don't qualify for COVID testing now under the new regulations. Is the province willing to give COVID tests to these people?
I think they sacrificed. They came here, and you notice, Randy, how the numbers dropped in Windsor and Essex and that, because they were following the guidelines. They were a little nervous at the beginning, but I think they deserve that, to say the least. They're the ones, folks, I know they got a lot of heat, the migrant workers, but keep in mind, the reason we were having veggies on our plate is because of these folks. I don't know if you've ever had an opportunity to go down to the Essex area and some of these greenhouses in the Niagara region and other regions as well. They're the ones that are putting food on our table. That's the least thing we could do is help these folks out, because they've helped us out.
Next question.
Your next question comes from Miranda Anthistle with Global News. Please go ahead.
Hi, Miranda.
Yeah, thanks, Premier. So my first question is about the first wave modeling. We saw back in April that it was projected Ontario would have seen 300,000 cases of COVID-19 and 6,000 deaths by the end of April if there wasn't any government interaction. So I'm just wondering, we didn't hear earlier today, perhaps this is a question for Dr. Williams, but what would be the projections for the cases and deaths in the second wave if there's no intervention?
I'll pass it to Dr. Williams. Thank you.
Yes, well, thank you. It's a good question, and we did discuss it at our modeling presentation with Dr. Brown and with Mr. Anderson this morning. The projection right now, if we're on the course that we're going, that by the second week in October, we're up to over 1,000 cases a day. And that was what we saw, the same rise in the first wave. And they were saying if we did nothing and we continue on that, we would have those numbers that you alluded to. The fact is that we did implement public health measures, and we brought and flattened the curve down and brought down to really low levels in the summer. The message from today is we can do the same thing again. People say, well, how do you know if masking, distancing, washing your hands, staying home if you're ill, all that kind of aspect works? It does, because we did it the first time. And everybody sort of got casual and got laid back in the end of summer and early September. Now we have to focus really hard back down again and complete the task ahead of us. It worked once, we can do it again. Ontarians, as the Premier said, I know he's a great leader in that way. Everybody pulled hard and everybody can do it because we have great confidence in Ontarians. There are some people that are choosing to act out, but that's not a big number. And we know that if we do what we're supposed to do, everybody does it all the time, every way, we can flatten this one down too and not have our 1,000 cases every day. But we got to focus and do the work that's ahead of us.
Follow up.
Thank you, Doctor. And this might be a question for yourself again or for Minister Elliott. Unlike the spring, we've heard the government say that you don't want to postpone surgeries and procedures, but we have the Ontario Hospital Association saying that right now acute care is already at 89%, and without hotspots like Toronto, the GTA, and Ottawa returning to stage 2 right now, they're saying that the healthcare system is going to be overwhelmed. So what is your response to that?
Pass it to the Minister of Health.
Thank you. Well, we know that our hospitals are experiencing issues with respect to capacity. I spoke with the association last night. I know that they would like to make a move back into stage 2. However, we're listening to the Chief Medical Officer of Health and the public health doctors who don't feel that we are at that point right now, but we're watching it daily, and that is why we are making arrangements to take a regional approach to things like dealing with the backlog of surgeries so that hospitals that are having sufficient and significant capacity issues, we can then divert some of those surgeries to other hospitals, because we know that it has been very, very difficult for many people who have been waiting for cardiac cancer surgeries and orthopedic surgeries for many months. To ask them to wait again for another number of months is going to cause significant stress for them and for their loved ones. So we're working very hard to put the money into advancing to create more capacity in our system, more critical care beds, more additional hospital beds. We're trying to deal with our home and community care sector so that some people that might otherwise need to be in hospital can be cared for at home with additional nursing assistance and personal support worker assistance. We're doing whatever we can to make sure that our hospitals can continue to do the great work that they're doing, both in dealing with COVID patients, with what we anticipate will be some flu patients as well, and in dealing with the backlog of surgeries and procedures that we know need to continue. So we have taken all of that into consideration with our Keeping Ontarians Safe plan.
Next question.
Your next question comes from Haley Cooper with News Talk 1010. Please.
Thank you. Hi, Premier. Thanks for taking our questions.
Thank you.
My first question is regarding testing. Almost 36,000 tests were completed yesterday, which is wonderful, but the backlog is approaching 70,000.
So are you worried the system is getting too far behind, and do you have a plan to clear this backlog expeditiously?
Well, we're putting an additional $1 billion into the testing and tracing side of things. I had a great call with Abbott Labs, and these folks are incredible. And I want to again thank the Prime Minister for putting that order in. But we need the antigen test, in my opinion. I was informed by Abbott that they submitted the test in August the 30th, and they're waiting for our friends at Health Canada again to get this test. And this is a test we can find out in 15 minutes. I think it's an absolute game changer for the education system, for long-term care, and it's absolutely critical. And I guess my frustration is, how can regulatory bodies in countries around the world approve this? How can the U.S. regulatory bodies approve this? And everyone's getting it, and it's taking this long to go through Health Canada. The answer I received was, well, we don't want to make the same mistake as Spartan. Well, you're comparing apples and bananas. Spartan's a small little company versus a worldwide company like Abbott with the approvals from multiple countries, and we need to get it out there. Again, I'm very grateful for what the Prime Minister did on the order with Abbott, on the other testing mechanism, but this is what we need. We need the rapid test we can distribute through education, long-term care, hospitals, healthcare, that people will know, and they told me it's 92% accurate. People can know in 15 minutes. Just imagine that, being able to go to a pharmacy, getting the test, waiting outside, coming back in 15 minutes, and you have your results. Why it's going to take so long is just beyond me. When we're in a pandemic, we're in a crisis, move, veet, as they say, with Health Canada. I'm sorry, I don't want to always pick on Health Canada, but man, they got to move quicker, faster. We're in a crisis. So that's my plea to Health Canada. I'm hearing dates out to December. You got to be kidding me. Do they not call other countries, other health areas and regulatory bodies to see their approval process and everything? I'd understand if it was just new and we're the only guys doing it, but we aren't doing it.
Follow-up?
Thank you. And my follow-up, given today's modeling projections, which show that it's entirely possible for up to 300 patients being admitted to the ICU daily across the province, if that figure exceeds 350, hospitals won't be able to maintain capacity or perform scheduled surgeries. Now, you did mention that you would like surgeons to work weekends to get through the backlog of surgeries, and it really seems that time is of the essence. So where do things stand on that?
Well, I'll pass to the Minister of Health, but we're pouring money, the $243.7 billion on top of, inclusive of that is another $783 million. I want to thank all the docs out there. You guys are incredible. As I mentioned yesterday, I had a friend that went in on a surgery for Saturday. He says the only reason I could get that is because of the funding that you're doing. So I want to give a shout out to all the doctors, the surgeons, the nurses, and we are building our ICU capacity, building it up. So as cases are going up, we're adding more beds, and I'll pass it over to the Minister. Thank you.
Well, as the Premier indicated, we are putting hundreds of millions of dollars into expanding capacity and assisting with these surgeries to happen and to make sure that we can deal with patients that have to come into acute care. We are anticipating the worst, working with Ontarians to make sure that doesn't happen, but we are prepared for it. Our plan deals with that. We have put money into making sure that we can have those additional surgeries be performed, but also to make sure that we have the acute care beds with the ventilators that we need, and as well as the other bed space in order to make sure that we can expand our capacity quickly if we need to. So we are ready to do that. We've had this plan in place for several months, and we're ready to move on it if we have to.
Next question.
Your next question comes from Brian Lilly with the Toronto Sun. Please go ahead.
Hi, Brian.
Hi, Premier. For you and for Dr. Williams, I'd like to hear My understanding is that Cabinet will be considering advice from Dr. Williams later today on returning Ontario or parts of the province to a stage 2, in particular related to restaurants and such. The Restaurants Canada analysis says that full-service restaurants would lose 80% of their business, fast food restaurants would lose 44% of their business. In Toronto, that would mean 33,000 lost jobs. In Ottawa, 12,000 lost jobs, just in food service alone. So my question to both of you is, as you try and balance all of these out, are you willing to tell 45,000 people in just 2 cities that their jobs are on the line as you try and deal with this?
Well, Brian, first of all, I guess I can say everything's on the table, but Dr. Williams has been very reasonable. He fully understands, we're measuring again between health and safety, number one priority, and the economy. These people are struggling, and how do you measure the mental health effects of people going bankrupt, not being able to bring a paycheck home, not putting food, losing their homes, being kicked out of their houses by not being able to pay rent. So to answer your question straight up, we aren't rolling back today. I'm not saying it's never going to happen, but today that's not a conversation that's going to happen in Cabinet. We're going to take the advice from Dr. Williams and the team like we always have. I'll pass it to Dr. Williams.
Yes, and I think it's premature to make conclusions about what would be the decision of Cabinet on the advice given to them on various things. I can't really comment on the details at the moment. We have looked at different aspects, whether we would be returning to stage 2 or not. As I already said earlier to a question, part of stage 2 and 1, 2, and 3 was closure of all schools. We're not planning to close any schools, so we're not emulating those stages. It's a different time. We're coming into a different process. So we're giving recommendations and advice from our public health measures table under the leadership of Dr. McEwen, and that's gone to Minister Elliott, and that'll be taken to the Cabinet, and they'll make a decision. I think you'll have to wait to see what the details of that are after Cabinet has considered our advice and our recommendations.
Follow-up?
So, Premier, I'd like to know your thought process then as you go through this. You're under incredible pressure. I can't imagine the pressure that you're facing with the Ontario Hospital Association calling for a return to stage 2. Daily, you get questions from the media on why you haven't gone back into a full lockdown. And then you've got, just in 2 cities, 45,000 jobs just in food service. So how do you balance between looking after the health of people and dealing with the COVID numbers and dealing with all the other impacts that go along with just shutting down people and cutting them off from their jobs, their income, their livelihood, and their business?
Well, Brian, we take a very measured approach. I listen to everyone. I rely on our health table and Dr. Williams and the Minister of Health on their advice, but it's a very measured approach, and I don't believe in taking the hatchet. I believe in very surgical approach. I believe in regions, and as Dr. Williams said, some are right across the province, but when you talk about basically shutting down the economy, that's an extremely tough decision. And again, I'll always listen to the health and the science from the table and from Dr. Williams. But again, he understands the situation. You have to measure, the impacts to people's livelihoods. And so I take the economy very, very seriously. It's not the same as when we were before. We know a lot more. We're better prepared. We have the PPEs. We have the schools. And every parent I talk to, and I'm sure it's not 100%, but the ones I talk to and the kids I talk to, they're as happy as punch to be back in school. And that's the other area we have to measure as well, which the minister has done a great job. Another quick shout out to the teachers, the school boards, principals. You guys are incredible, absolute champs. So we weigh everything, Brian, absolutely everything. Nothing we do is just a quick decision, bang, do it, scalpel approach. I don't believe in doing that. I should say a hatchet approach. I don't believe in that.
This will be the final question.
Your final question comes from Mike Crawley with CBC News. Please go ahead.
Hi, Mike.
Hi, Premier. You keep talking about the pandemic plan, the preparedness plan, and you've released bits and pieces of it day by day over the past week or so. Why haven't we seen the full plan yet, and when are we going to see it?
Well, we're rolling it out day by day, and Mike, the reason we did it day by day until people can absorb it, comprehend what we're doing, and that's with anyone. If I go out here and just roll everything out and tell you 50 different things, people aren't going to absorb it, but we're doing it piece by piece every single day, and the minister's done a great job in rolling this out. I'm going to pass it over to the Minister of Health. Thank you.
Well, we did believe it was a complicated and comprehensive plan that we needed to have several days in order to explain it to the members of the public so that they would know that we anticipated all of the relevant factors in putting the plan together and being able to implement it. But it is going to be available to the public. We're prepared to release it very shortly. So I would say within the next day or so, it should be available to you.
Follow-up?
My follow-up is a question on behalf of my colleagues at CBC Windsor. There is no lab facility in Windsor for processing COVID-19 tests, so those tests are sent to London. We're told that there's a private lab in Windsor that has been in negotiations with the government since March about doing COVID-19 tests or processing the COVID-19 tests in Windsor. What's taken so long, and is there any prospect that there's going to be a lab in Windsor to process the large number of tests that are happening there?
Mike, I give you my word. When I leave this room, I'll be on the phone with Matt Anderson, and very good point in Windsor, but I'll pass it over to Dr. Williams. But we need to have the labs. Going back to my point about the quick rapid test, wouldn't it be great if we get this equipment in Windsor and over in Chatham and Essex and everywhere? That's why I've just been pounding the pavement with Health Canada to get these approvals. I always go to root cause or the 5 whys. If you find out a problem, why, and you'll find out the answer. And everything goes back to long lineups, testing. Getting results quickly, testing. And it all comes down to Health Canada, again, giving us the approval and a safe approval to move forward. It's not, and I always say, I'm no doc, I'm no medical professional, but it doesn't take a rocket scientist to figure out if we aren't ingesting it, we aren't orally taking pills or something, and you're putting saliva on a stick, or you're getting a nasal swab, like, I don't know, in other jurisdictions around the world, regulatory bodies that are probably larger than ours, including the FDA and other regulatory bodies in the U.S. and governors right across the sea, and the size of Abbott and their scientists, and you think they want to jeopardize anything? No. Let's get this approved, and it's a game changer. So I'll pass it over to Dr. Williams.
Yes, well, the idea of different labs and the different groups that want to step up and to deliver these ones, we have a lab network. As the Premier said, he's going to go out and ask Matt Anderson, who has that aspect under his responsibility. The details that we can't answer today because I don't know the details of that lab, what it has, what its limitations are. It has to meet a number of standards and criteria. They may not. I don't know the details. So we'll have to see what they say, because if they don't do a proper job, if there's some issues and concerns, then any results that, of course, are inaccurate or false, that leads to a lot of other challenges and problems, including arising a lot of anxiety among public. So we want to make sure if it is going to work, it's going to work well, going to work consistently, and as an adjunct or another part in the overall lab network. And as Minister Elliott's been talking about, increasing the capacity back up. So all these things are on the table, but it goes through the process of considering what they can bring to the table and whether they meet the criteria for quality test proceedings as well as procedures and results.
Thank you, everyone.
Thank you, everyone. Thank you.